Hi, my name is Mike Milligy, and I am a certified licensed Medicare health insurance broker. I'm also a card-carrying Medicare man myself, which means I've gone through the process that you're going through now, and I've helped a lot of people go through it. Today's installment, we're going to speak about Medicare Part C, which is also known as Medicare Advantage. You hear talk about Medicare Part C all the time on the television. Various people like Broadway Joe Namath. Advertising Medicare Part C. They actually say it's the new Medicare Part C. It really isn't. Medicare Part C plans have been around for quite a while. Medicare Part C Medicare Advantage plans offer you coverage very much like what you already have or have had, say with an employer. They come in various flavors. For example, they come in HMO. Okay, we know what that is. You've got to stay in the network of doctors. They also come in PPO, which is in and out of network. All right. There's many more, but we're not going to take that time today with that because these are the most popular. As a matter of fact, probably the most popular is going to be PPO. A lot of people like the flexibility. Medicare Advantage gives you help paying for parts of original Medicare. So it gives you some help paying for your Part A. Doesn't pay a premium, but in terms of what you're going to pay if you go in the hospital. It also helps cover stuff with Part B. Reduces some costs to copays instead of that 20% co-insurance you're going to pay. Also, most of them, a lot of them have a Part D prescription drug plan already embedded with them. One of our other modules, we talked about original Medicare. Original Medicare is Hospital A and Medical B. Original Medicare does not cover prescription medications that you would get by going down to the local CVS, local drugstore. So if you were on your Medicare card, all right, you would still have to add a drug plan. These plans usually have one embedded, so you don't have to bother adding a drug plan to it. So when you see a term MAPD, what that stands for is Medicare Advantage with prescription drugs, all right? These plans have some are taken care of by the government, so I'm not going to get into that too much, but as far as the monthly premium goes, it's very low. In some cases, it's as low as $0, okay? So the only thing you're really going to pay for some folks is your Part B premium of $164.90. But now what you're going to have is copays with these plans. Kind of like what you have now. You can have copays for everything. Primary care, specialist, obviously MRIs, tests. All right. You're going to some of them will give you actually a gym membership, more than original Medicare. Original Medicare doesn't do that. Also, original Medicare does nothing for dental and does nothing for vision. So a lot of these plans will give you a dental and a vision option. All right. Now, also, if you know anything about original Medicare, again, Hospital A, Medical B, there's no limit to what you can spend with this little card, all right? The sky's the limit with it. They're just going to pay what they're going to pay, and they're going to expect you to pay. These plans have caps, all right? What's also known as a MOOP. What is a MOOP? A MOOP stands for Maximum Out-of-Pocket Expense. Maximum out-of-pocket. That means when you reach that, you're no longer going to pay any more copays. The plan will continue to pay, and you will not pay another one. All right. So for the rest of the calendar year, this move could be as high as $7,500. All right. Maybe a little bit more, maybe a little bit less. This is a New York number, by the way. In some other states, it's actually less, and that would be an in-network number. If you were to go out, it could be around $11,000. That is the most that you would pay for your copays and services in that calendar year. Okay, Medicare Advantage is a very popular plan choice. The only thing you have to be concerned about, obviously, is when you're going to go on one, obviously you have to make sure your medications are covered. Also, it's very important to check doctors to make sure your doctors will actually take that health insurance plan. They all have networks. Oops, very sloppy, sorry. But some of the networks are larger than others. Some of the plans are more portable than others. For example, with an HMO, if that's what you were on, and you were in another state, you could get health coverage, but you would be going to an emergency room. With a lot of the other plans that are PPO, if they have a doctor network there, you can use them as if you were at home. If you recall from some of the television commercials, they say, give us your zip code. You know, it's like a magic zip code to see if you qualify for the benefits that they're talking about. It really isn't based on zip code at all, it's based on county. So depending upon what county you live in, that's going to determine what Medicare Advantage plans are available to you. If you move, you'll have to pick another plan in that local area because they are area based, okay? There's more to go over this. Feel free to give me a call. We can go into a little more depth. I just wanted to give you some basic knowledge about Medicare Advantage. As always, you can feel free to call me. My number is 631-774-3786. If you want to send me an email, it's mmilinsurance@gmail.com. And also, feel free to visit my website, mymedicaremike.com, and there's a lot of information in there. There's videos and there's blogs. You can get everything you need to know, or just give me a call. Thank you very much for watching. I appreciate it.